I see midwifery as a calling. What is the love we have for this job? It is that commitment and dedication, especially this PI age, for vulnerable people and the poor people. How are you? The rich ones can go abroad for treatment, but the poor ones, they come here, and those are the ones that we see every day, that needs our help, that needs to hear from us. Oh my God. She's been having this pain since yesterday before I left.
Jesus.
Sorry, eh?
Okay.
But the pain, is this your first baby? How many? Number waiting. Number 2. See, the baby is moving. You have to drink plenty water, huh? This pain is not too strong yet. I am a nurse, a midwife, an educator, and I have degrees in public health. The joy of every midwife is at the end of labor. We hear the voice of the woman and the cry of the baby. I love watching it. That is what our project is all about. Reduce maternal death and reduce neonatal death. If a mother dies here, it becomes so difficult for me. As I was growing up, my father abandoned us. We had no money. My half-sister supported us, and she was pregnant. There was an obstruction. The baby wasn't coming down. We were waiting for her to come with the baby for us to see. Only for the midwife to come out to say no, that she died. I vowed that no woman, God, that I will do everything possible to save a woman from dying. And that vow, I thank God I've kept it. Sia, a young lady of 26 years old, was referred to KGH for fear of obstructed labor and the complications that might follow it. CPD, the full meaning is cephalopelvic disproportion. The bony pelvis is too small to allow the baby cell to pass through during labor. There's something about that girl that you just see her, you love her.
That can have a son now. What are you now? What are you? The baby, they do fine and good. Yeah?
Where facility did you come from? Leah, did you go to the clinic there?
Yeah.
So throughout your clinic, they didn't tell you anything, eh? The nurse, midwife.
Now they send me.
Yeah. So you go clinic 1, 2, 3, 4, 5, 6, 7. Midwife did not say anything. So how did the baby stop now? You know, no movement again, eh? Ah. Ah. Did they do ultrasound?
Yes, they did ultrasound.
And no life again.
At all.
Why did they not refer her early?
And the previous pregnancy, the same thing happened.
No, then it should be
Another.
ISO immunization. Because having a intrauterine death the second time, it's a bad obstetric history. It's bad, so I don't know. And for her to have attended clinic 7 times and for this to happen, why did they not refer her early enough? The woman was referred with intrauterine fetal death. This woman case has really put me down again because having carried this pregnancy to term and this type of thing happened is really sad. That means we failed as midwives. We failed her. That was just what happened. I usually tell them, please, 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 poor obstetric history, refer. Severe malaria in pregnancy, please you refer. Severe headache, refer. If the woman is vomiting excessively, you refer. Better you refer. We keep them in the birth waiting home that will go there to manage them, and there are nurses, there are midwives, than you trying to keep them in that your community and giving them hopes, and at the end it ends like this. So it's really so sad. It's really sad. So we have failed her again. I don't know.
Total number of deliveries 14. Total number of spontaneous vaginal delivery 7. Total number of cesarean section 7. Total number of stillbirth 1.
This young lady attended ANC 7 times. She lost her first baby. This second one came out macerated. A young girl. I really want to know what went wrong. Please find time. I don't know what we can do to help this woman in case she wants to get pregnant again. What to help her, even if it's for her to go on family planning for some time, so that we really fish out what is really happening with that lady. Because seeing her this morning, she was not looking well.
For them, this was a referral to KGH. Whatever happened in KGH as a result of KGH management, how do I know how well or not I'm doing if I'm not getting feedback and constructive, support to say that if the next time, these are the things that you need to look for. So they would then be able to do something about it. But from within here, if we just talk about it, it's not going to happen.
There is no patient that should enter here and not get quality care. No patient here. These patients, they come here because they want to get treatment. So nurses, midwives, please, let's do our best. They fear for the operation.
They free there?
They afraid? Eh? Tell me.
Halfway.
No. Don't be scared. We want to see the baby come out. I will follow you. You see me in the theater. I will stand by you there. I will carry your baby for you. And I will dance. When I joined in 2022, we recorded 23 maternal deaths. I called a meeting and I told them, I said, look, this has to stop. I sat with the doctors. I met with the nurses and the midwives. I told them the vow I made. as long as this patient enters there breathing alive, she must not be carried back home dead. Doctor, she's contracting now. There's contraction now. For Sia, she's not allowed to go into labor. It's dangerous to herself and the baby. It might rupture the uterus and will not survive it.
We need for Koidu now that you believe the heart. So this it all become emergency now. You don't understand? We don't wait till tomorrow. So now with the Koidu because she believe don't be the heart. Don't understand?
The Lord is our light and our salvation. Your plan is your plan. Now, this pregnancy, I do not expect for them to tell me about the CS. And I believe and trust you that you will be able to save my life. I pray to you that you guide and protect me. Amen.
You see, I told you I would be here. Eh? Don't cry, yeah?
Knife on skin.
I was so happy in the sense that one, the baby is okay, and the mother was also okay. She was so happy and smiling when the midwife now took the baby to her. And it was really a thing of joy to see her, how happy she was, and that made me happy too. So what keeps me going is, again, the vulnerable and the poor ones we serve. I don't like seeing people suffer. At times I go home, I reflect. What have I done today? What wrong did I do? What good did I do? And so that when I come the following day, that thing I know I did not do well the previous day, I start from there. So that motivation is always there. I want to put smiles on their faces.